If you have stiff hips, then the 7 hip mobility exercises in this video may be right for you. Now, these exercises are particularly good for people with hip joint problems, such as hip arthritis or femoroacetabular impingement. They're also good for people with lower back problems or knee problems, because often when your hip joints are stiff, your body ends up compensating either above at your lower back or below at your knees. So if you have stiff hips and you'd like to improve your hip mobility, then stay tuned. Now, if you don't know who I am, I'm Dr. Dave Candy. I'm a fellowship-trained orthopedic manual physical therapist. And the exercises in this video aren't just any hip stretches. They're specifically designed to simulate hands-on techniques that we use here in the clinic. Now, when you have stiff hips, you can't just stretch the muscles. You actually have to stretch the hip joint capsule. And often we do that with hands-on techniques. But since I can't reach through the screen and stretch your hips, we're going to use an exercise band instead. Now, you need a pretty thick band for these exercises. You can't just use a flimsy band like you'd get at a physical therapy office. But fortunately, these are fairly inexpensive. I got this one on Amazon for less than $10, and I'll put a link in the description down below if you need one. But if you're ready to improve your hip mobility, then let's get started with the 7 stretches. The first exercise is an all-fours rocking exercise. This is to improve the motion of hip flexion, which is bringing your knee closer to your chest or your chest closer to your knee. Now, this is different from the child's pose because it's not a lower back stretch. We actually want to isolate the motion to your hip. This is good for people who have trouble lifting their leg, for example, going upstairs or getting in a car, or people who have trouble bending down, for example, to put on shoes or socks. Those are all hip flexion type of motions. Now, when you go into hip flexion, the ball of your hip joint has to glide towards the back of your body and also downwards towards the foot of your body. And so this exercise, even without the band, is good because it uses gravity to push your body downwards, and that drives the ball of your femur backwards in the socket. Now, if you can't get on your knees, this is good to do on a bed as well. And there are other exercises that if you absolutely can't kneel because of knee arthritis, there will be other options that may be good for you later in the video. But for this first exercise, you want to get your back arched down slightly, not all the way down, not all the way up, but kind of a middle position, but erring a little bit more towards in an arched position. And that helps ensure that as you rock back, your lower back doesn't round out and you isolate the motion just to your hip joint. So you rock back, and that creates a posterior or backward glide of the hip joint and helps mobilize the back part of the hip capsule. Now, you should start to feel like you get a little pinching when you hit the end range of your motion, and that's really where the band is going to come in. So now you take the band, and you're going to secure it to something heavy. It should be a heavy piece of furniture, and to do that, you just wrap it around like that. Then you put one end through the other and just pull it tight. So now you have the band secured. Next, you're going to put your knee inside the band like this, and then pull the band up as far as you can towards your groin. You want this as close as possible to the actual hip joint, so really slide it up in there. Now you want to crawl forwards and get a lot of tension on this band. Now you're going to, again, kind of tilt your pelvis a little bit and rock backwards. And this helps with that pinching that you got before, because now you're using your body weight to glide the femur posteriorly, as well as the band to glide it downwards towards your feet or inferiorly. And you can get more stretch just by crawling forward a little bit more and then rock back. If you're doing this right, you should notice that that pinch is a little bit less, or that you're able to get farther into hip flexion before you start getting that pinching motion. Now, if you absolutely cannot kneel, then the other option would be to do it on your back. So instead of being kneeling, you put the band around your leg like this, scoot back so there's some tension on it, and then pull your knee up into hip flexion here. Now this gives you that same inferior glide. It's not as great because it doesn't push downwards. You don't get that posterior glide as well, but in a pinch, it's certainly still a good exercise to do. And again, the more you scoot backwards, the more tension you put on the band, the bigger mobilization force it's going to give you. And make sure you keep it pretty close to the actual hip joint. Now, while we're down in this position, there's another good hip mobilization you can do lying on your back. And to do that, you're going to have to turn a little bit. So you want the band to be coming sort of sideways. It's not a perfect 90-degree angle. It's also not a downward angle. It's about 30 to 45 degrees. And the normal neck shaft angle of your femur is about 120 to 140 degrees, which amounts to you want an angle relative to the horizontal, about 30 to 40 degrees below that horizontal. And so you're going to put the hip in that position. Now do what most people know as a piriformis stretch. So you go into a figure 4 like this. Again, create tension on the band. And then you just do that normal figure 4 piriformis stretch. But now you're getting a distraction along the angle of the neck of the femur. And so then you just hold that position, and typically a couple of minutes, 2 minutes or so, is a good time to do this type of stretch. It does take a long time for capsular tissue to stretch out, so holding these for a few minutes is a good idea. So just hold that in a comfortable stretch, and as you go, you may notice you can go a little bit farther into the stretch. You may have to periodically adjust the band or adjust your body position to find the right line of force. Now this next exercise is a variation of the last one for people who can't get down on the floor to do that lying down piriformis stretch. And for this one, you're going to take the band and loop it underneath a chair so that one edge of the band comes out of either side. And you're going to take the leg that you're stretching and put the band around it and grab the other hand. You want to pull this up so that it goes underneath the chair. And again, try to get it as close to the actual hip joint as you can. Now you're going to take this other end of the band and loop it around your arm. Get it in as deep as you need to so that you can kind of pull some tension underneath the band. And so you're going to be looping it underneath the chair, kind of using the chair seat as a pulley, and then pulling up on this side. That's going to create a distraction force going out that way. So similar to what we did with the last one. Now you cross your leg, and if you can get it up all the way, that's great. If you can't, you can kind of put it halfway up, but try to get it as close up as you can like that. Then do that piriformis stretch, just seated. And to get more tension, you just pull more tension up on the band and then stretch it. You can kind of use your elbow like a lever to help control how much tension is pulling down on the band. And again, that kind of pulls your hip joint down and out, away from the joint surface. So it gives the joint a little bit more movement while you're stretching the muscles in the back part of your hip. Now these next two exercises are a little bit more advanced. You do need to be able to kneel on one knee, but they are really good hip mobilizations if you're able to get down on the ground and kneel on one knee. And if you're not, don't worry, the last exercise is one where you don't even have to get down on the ground. So for this one, you're going to put your knee through the band, and again, pull it up in your groin, and then pull tension out on the band. Now the hip that you're going to be stretching is going to be the one that's up. For this one, you want kind of the same distraction force, so it's pulling down and outwards away from your body, so not quite a perpendicular, but a little bit down, outwards, and back. Then you're going to take this knee, and as the band is pulling out that way, you're going to pull your knee inwards as much as you can. That goes into adduction and internal rotation of your hip, along with this hip flexion position. So this is the most compacted position of the joint. It's where there's the least joint space. So you're taking it into the most restricted position while the band is giving you some more space. And so you just go back and forth like that into hip internal rotation. And again, if you need a little bit more pull on the band, you just go back and forth like that. Now you can do a piriformis stretch in this position too if you go into what they call a pigeon pose in yoga. And to do that, you'll want to slide your legs out into a little bit of external rotation, and then the band is distracting you back that way. Now this is a really good stretch, but it's also quite a hard advanced stretch. So don't jump straight to this one. I'd try one of those other figure 4 stretches before you progress to this one. Now the final stretch down here where we're kneeling is going to be one where you have one leg forwards, and for this one you want the band pulling straight back. This is good for people who have an anterior glide of the hip, where the hip starts to glide too far forwards into the socket and can start to pinch on the structures in the front or start to irritate the hip flexor muscles. And so for this, you're going to do a hip flexor stretch, but at the same time, the band is help keeping the ball of the femur backwards in the socket so it's not gliding forward and irritating the hip flexors as you're stretching them. And so you do the stretch like this. Now you want to make sure you don't arch your lower back too much. So make sure you kind of roll your pelvis under, push your pelvis forwards so you feel a strong stretch in the front of the hip and the thigh, and then the band is kind of pulling backwards, holding the femur in place where it's supposed to be. Now, if you can't do the kneeling hip flexor stretch, this last exercise is a standing version of the same thing. To do this, you'll need to attach the band a little bit higher. So put it around something roughly waist height like a railing. Loop it around. Then you're going to put your foot through. And again, pull it up so it's in your groin in the front of the hip. Now you want the band to be pulling backwards as you go into a hip flexor stretch. So roll your pelvis underneath, and you should feel a stretch in the front part of your hip and the front part of your thigh as the band is pulling backwards, keeping the head of your femur centered in the socket. So those were the 7 hip mobility exercises using a band. Now, probably not every exercise is going to work for every person, but try them out and find the 2 or 3 that work best for you, and then just ignore the rest of them. Now, if you try them out and you find out that you do still need some more help, although they're good exercises, it's not the same as seeing a trained orthopedic manual physical therapist who knows how hard to pull, which exercises to do, when, and why. And so if you are in the St. Louis area and you need some more help, feel free to contact us here at More for Life, and we'd be happy to help you. And if you're watching this from somewhere else, but you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.